Peripheral arterial disease, or PAD, is a condition in which plaque, or material composed of cholesterol, calcium, and fibrous tissue, can build up in the arteries of the circulation. PAD can occur anywhere in the circulation, often affecting the legs and the pelvis, but it can affect any organ in the body or the brain. Atherosclerosis is the process where plaque builds up in the circulation, and it can affect the peripheral arteries, like PAD, and when it affects the heart, that's called coronary artery disease. Both of these processes are similar and have similar risk factors for their progression and development. The relationship between the two goes further in the sense that having one condition can put you at risk for having the other. The signs and symptoms of PAD vary depending on what part of the circulation is affected. PAD typically occurs in the legs, and when that happens, patients with PAD may experience pain or discomfort in their legs when they walk. Unfortunately, these typical symptoms occur in only about 10% of patients with PAD. Up to 40% of patients with PAD may have more atypical symptoms that are difficult to recognize as being caused by PAD and may often be attributed to something else. Unfortunately, not everybody with PAD has a warning sign or symptom to let them know that they have this condition, and as many as 50% of patients may have no warning sign at all. The risk factors for PAD are the same as those for coronary artery disease, and they include smoking, diabetes, high blood pressure or hypertension, abnormal cholesterol, and older age. Of these risk factors, smoking and diabetes appear to be the worst. It's also recognized that having vascular disease in one area puts you at risk for having vascular disease in other areas. So having coronary artery disease does put you at higher risk for having PAD. There are two concerns for patients who have PAD. The first is the direct effect of the circulatory problem itself. For example, if PAD occurs in the legs and is very advanced, it can cause tissue loss, ulcers that fail to heal, and in very severe cases can lead to amputation. The second concern, which is just as important or maybe more important, is the overall risk of the patient's health from PAD. In fact, the risk of heart disease and stroke in patients with PAD is 4 or 5 times higher than in patients who don't have PAD. The first step for someone who feels they may have PAD would be to discuss their condition with their doctor. The simplest way to diagnose PAD is with a test that can be performed in your doctor's office called the Ankle Brachial Index, or ABI, and simply involves measuring the blood pressure in the arms and in the legs. This test takes just a few minutes to perform and is a quick and principal way to make the diagnosis of PAD. Ohio Heart offers comprehensive evaluation and treatment for patients with PAD or for those who are at risk of PAD. We offer full diagnostic in-office screening for PAD, as well as identification and management of risk factors. We offer comprehensive treatment of those risk factors with the latest in medical techniques. And for those patients who require more advanced treatment of their PAD, we offer the full range of minimally invasive treatment options for treating all levels and all areas of PAD. PAD is a complex condition whose treatment is complex, and so care is also coordinated through a patient's primary care physician and allied specialists as needed.